cherry eye is also known as a prolapsed third eyelid, and this might sound scary, but I'm here to help. I'm Dr. M. Welcome to VMC. Today, we're diving deep into the world of cherry eye. What it is, what animals are predisposed to it, treatment options we have, and everything that you need to know to get your animals seeing clearly again. Join me, you'll learn something today. Before anything else, you first need to understand what a cherry eye is. Cherry eye is the common layperson term that people will use when they are referring to the prolapsing or moving out of place or bulging out of place of the third eyelid. Humans, we're pretty boring, we only have 2 eyelids. But there are a lot of mammals, including cats and dogs, who actually have 3 eyelids. Good girl, you can lay down there. That's good. Very good. In the mammals that have a third eyelid, it sits in the inner corner of the eye nearest the nose, and it will move up a bit diagonally across the eye. Think a little bit like a windshield wiper. Some people might also call the third eyelid a nictitating membrane. This third eyelid serves as additional protection for the eyeball, and importantly, it also contains a gland that produces a significant portion of the tear film that your animal's eyes need. Now, the third eyelid is normally anchored to the inner lower rim of the eye, and it's held there by a fibrous attachment. In some specific animals and in some breeds, this fibrous attachment seems to be a bit weaker than it needs to be, and this predisposes those animals to a prolapse of the third eyelid, aka cherry eye. There are a number of breeds that are most impacted by this, like the Cocker Spaniel and a number of brachycephalic breeds. The Burmese and Persian cats are also breeds that are predisposed to a third eyelid prolapse. At this point, we do believe that there is a genetic component to developing the prolapse of the third eyelid, so if there is ever an animal that has had this, they must not be used for breeding. In addition to the hereditary aspect, we think there might be some other factors at play, but we don't fully understand what those are at this point. The most common and well-known clinical symptom is that people will notice a mass near the nose or muzzle of their animal has appeared in the corner of the eye. It's usually pinkish to red in color, and some people think it resembles a cherry, hence the name. This prolapsed third eyelid may be quite large and cover a significant portion of the cornea, or it could be smaller, and it can appear periodically in some patients. This is important because when the third eyelid prolapses out of its normal position, it doesn't get the blood flow that it needs. That is why it swells and changes in color. In addition, not getting appropriate blood flow can also compromise the ability of the third eyelid at producing tears. And if we don't deal with this quickly enough, that damage to the gland in the third eyelid can be permanent. So how do we go about treating a prolapsed third eyelid? Well, there are a couple of options. However, it does always involve a surgical procedure. It is essential to address and treat the third eyelid prolapse as promptly as is possible in order to reduce the risks of long-term damage to the tear production of that eye. When animals experience a loss of tear production, they can develop something that we call keratoconjunctivitis sicca, KCS for short. Some people will just refer to this as dry eye. Animals that are experiencing KCS will have a significant amount of ocular pain. The eye will be dry, itchy. They can have some vision impairment from this. They can also be very predisposed to developing ulcers or scratches to the cornea that can be extremely serious and very painful. For that reason, until surgery is performed, a lot of the time we will recommend that you use artificial tears in order to help keep that eyeball better lubricated. Many dogs and cats will be annoyed or irritated or have some pain from the prolapsed third eyelid, and so they can be rubbing at their eyes with a paw. For that reason, we tend to use a lot of Elizabethan collars, or cones as some people know them, in order to help protect the eye from trauma. The most common surgical technique is a procedure that we most frequently refer to as a tuck and tack. This involves replacing the prolapsed third eyelid to where it's supposed to be, and then using a permanent suture in order to hold it into its proper place. Now, it is important to know that occasionally this stitch may fail in some patients for a number of reasons that we don't fully understand, and it's possible for 5 to 20% of patients with a prolapsed third eyelid to not have a successful repair done with the first surgery. There are some GP veterinarians who can do a tuck and tack, and others aren't comfortable with it and will refer you to a veterinary ophthalmologist right away. So there may be some patients where that most common tuck and tack procedure isn't recommended or just hasn't been successful. The second most common surgical procedure is called imbrication. In this, what we are doing is creating a new pocket for the third eyelid to live in. This procedure is generally done by a veterinary ophthalmologist because it requires more specialized equipment and it's a bit more finicky of a procedure. One very important thing that I need all of you to know is that removal of part or all of the third eyelid is never an appropriate treatment plan for an animal that has a prolapsed third eyelid. Now, to be fair, before I went to vet school, this is something that was taught and that was done. This is because at that point, we didn't understand the very important role that the third eyelid played in tear production. Once we learned that removal of part or all of the third eyelid would result in a lot of those animals developing KCS later in life, we did a better job investigating the role of the third eyelid in the eyeball health. And now that we know better, we do better. And we replace the third eyelid back to where it's supposed to live. We do not take it out. If you are ever recommended removal of the third eyelid, you will need to see a different veterinarian who's more current with their knowledge base in this issue, and that may mean a veterinary ophthalmologist. Now, the wonderful news is that for most patients, by a couple of weeks after surgery, the swelling has gone down and they are back to their normal selves. What you should know is that if an animal has had a third eyelid prolapse in one eye, there is a chance that at some point in their life they could have this occur to the other eye. Some animals will present with both prolapsed at the same time. That just varies from patient to patient. The other thing to know is that despite us replacing that third eyelid, sometimes the tear production in that eye is damaged if the gland was prolapsed too far or for too long. As a result, the recommendation is to carefully monitor tear production in these animals that have this history for the rest of their lives. So for the rest of their lifespan, every time that one of these patients comes in to see me for their yearly or every 6-month physical exam and vaccines or whatever else we might be doing, we will just check a Schirmer tear test at the same time, make sure that their tear production in the eye is remaining within the acceptable limits. If it starts to go down over time, then we have treatments we can use to help that animal keep their eye comfortable and well lubricated. If you have any questions about cherry eye, or you have a topic you'd like me to cover in the future, please comment it down below. I love to hear from you. We do put up a new video most Fridays, and YouTube thinks that you'll like this video. I hope that you have a wonderful week, and we'll see you in the next one. Bye.